Hello and welcome. Today we're diving deep into the world of lung diseases to explore a condition known as pneumoconiosis. This isn't just one disease, but rather a group of lung diseases caused by the inhalation of certain dusts. Join us as we unravel the complexities of pneumoconiosis, from its causes to its potential treatments. Pneumoconiosis is essentially an environmental lung disease, meaning it's directly linked to what we breathe in. The primary culprits are specific types of dusts, often found in industrial settings. These include mineral dusts like silica, asbestos, and coal dust. Prolonged exposure to these particles leads to their accumulation in the lungs, triggering a cascade of damaging events. The risk is particularly high for workers in mining, construction, shipbuilding, and other industries where dust exposure is prevalent. So, what happens inside the lungs when these dust particles are inhaled? The process is a bit complicated. First, the particles are inhaled and deposited deep within the lungs, reaching the alveoli, the tiny air sacs where gas exchange occurs. Because these particles are foreign and often irritating, the body's immune system kicks in. Macrophages, a type of immune cell, attempt to engulf and remove the dust. However, some dusts, like silica and asbestos, are particularly difficult to clear. The macrophages become overwhelmed, and they release inflammatory substances that cause damage to the surrounding lung tissue. This chronic inflammation leads to scarring and fibrosis, stiffening the lungs and impairing their ability to function efficiently. Over time, this damage can lead to significant breathing difficulties and other complications. Pneumoconiosis affects specific populations primarily. Its prevalence is directly tied to occupational exposure. Therefore, miners, construction workers, shipyard workers, and those involved in manufacturing processes that generate dust are at the highest risk. Historically, pneumoconiosis was a significant public health concern, particularly in areas with heavy mining activity. While regulations and safety measures have improved in some regions, the disease remains a serious threat in many parts of the world, especially in developing countries where occupational health standards may be less stringent. The signs and symptoms of pneumoconiosis often develop gradually over many years. In the early stages, individuals may experience no noticeable symptoms. However, as the disease progresses, the most common symptom is shortness of breath, especially with exertion. Other symptoms can include a chronic cough, often producing phlegm, wheezing, chest tightness, and fatigue. In severe cases, pneumoconiosis can lead to respiratory failure and other life-threatening complications. Diagnosing pneumoconiosis typically involves a combination of medical history, physical examination, and diagnostic testing. A detailed occupational history is crucial to determine if the individual has been exposed to relevant dusts. A chest X-ray is often the first imaging test performed, which can reveal characteristic patterns of lung damage, such as nodules or scarring. Pulmonary function tests, also known as breathing tests, can assess lung capacity and airflow, helping to determine the severity of the lung impairment. In some cases, a CT scan of the chest or a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. Pneumoconiosis isn't a single disease but a category with different types, depending on the dust inhaled. The most common types include coal workers' pneumoconiosis, often called black lung, caused by coal dust. Silicosis results from inhaling silica dust, commonly found in mining and construction. Asbestosis, caused by asbestos exposure, is particularly dangerous as it increases the risk of lung cancer and mesothelioma. Each type has its own characteristic features and potential complications. Unfortunately, there is no cure for pneumoconiosis. Treatment focuses on managing symptoms and preventing further lung damage. This typically involves pulmonary rehabilitation, which includes exercises and education to improve breathing and quality of life. Bronchodilators can help to open up the airways and ease breathing difficulties. Oxygen therapy may be necessary for individuals with severe lung impairment. In some cases, lung transplantation may be considered as a last resort. It's also critical to avoid further exposure to the offending dust and to quit smoking, as smoking can significantly worsen the disease. Prevention is the most effective strategy for combating pneumoconiosis. This involves implementing strict dust control measures in workplaces, such as ventilation systems, dust suppression techniques, and the use of personal protective equipment, including respirators. Regular medical surveillance for workers at risk is also crucial for early detection and intervention. Education and training programs can raise awareness about the hazards of dust exposure and promote safe work practices. The prognosis for individuals with pneumoconiosis varies depending on the type and severity of the disease, as well as individual factors such as age and overall health. In some cases, the disease may progress slowly and cause minimal symptoms. However, in other cases, it can lead to significant disability and reduced life expectancy. Recent research efforts are focused on developing new treatments to slow down the progression of the disease and improve the quality of life for those affected. This includes exploring potential therapies to reduce inflammation and fibrosis in the lungs. Continued research holds promise for finding more effective ways to manage and potentially prevent pneumoconiosis in the future.